Unbelievable. You can get anxiety from even watching that, knowing how jams are in Nairobi alone. Now, as the 10th and worst Ebola outbreak in the history of the Democratic Republic of Congo enters its second year, the situation on the ground is of concern. Back home in Busia, health officials at the Busia one-stop border post have intensified screening. Health experts say there is no major cause for alarm as adequate measures have been put in place to ensure there is no Ebola outbreak in Kenya.
It's been 1 year since the Ebola outbreak was declared in the Democratic Republic of Congo, the largest outbreak in the DRC and the second largest in history, following the 2014 outbreak in West Africa. In just 1 year, the outbreak has affected over 2,600 people and caused over 1,700 deaths. The overall mortality rate is 67%. Ebola has still not been brought under control, with the latest victim dying Wednesday this week. On 17 July 2019, the World Health Organization announced that the outbreak constitutes a public health emergency of international concern.
But we still see that every week about 80 to 100 new cases have been identified, which means there is still a lot to do in terms of preventions, in terms of treatment of patients.
When the DRC sneezes, her neighbors begin to catch her cold. In June 2019, the outbreak spread geographically, with Uganda seeing its first patients.
And that is why this announcement of WHO about the public health emergency of international concern is supposed to alert all the governments surrounding to apply standard procedures to contain the epidemics.
Health officials at the Busia one-stop border have intensified screening against the Ebola virus after at least 4 people from the DRC are reported to have used the border in the last 2 days. At the Busia Kenya Port Health Desk, all arriving travelers from Uganda, Congo, Rwanda, Burundi, South Sudan and the DRC are being subjected to screening, including truck drivers and border riders. An isolation ward has been set up at the Busia County Referral Hospital and at the Malaba dispensary, where any suspected Ebola cases are quarantined.
When the cases in Kampala are reduced, we embarked on routine duties, screening.
The challenges for humanitarian agencies such as MSF and the DRC government health workers intervening to control the outbreak abound, including attacks on health facilities, lack of trust, lack of access to healthcare that will facilitate early detection and diagnosis. Dorcas Wangira, Citizen TV.